Hello and welcome to Behind the Insights, where we pull back the curtain to share real-world data, AI, and evidence generation insights from the industry's top thought leaders. I'm Maria Demko, and joining me today is Chandra Gopalakrishnan, MD, MPH, and Principal Epidemiologist at OM1. In this episode, we'll be discussing an award-winning ISPOR poster that investigates predictors of low disease activity, or remission, in rheumatoid arthritis. Despite the availability of RA therapies, many patients fail to achieve remission, highlighting the need for more effective treatments. Welcome, Chandra. It's great to have you here today.
Thanks so much for having me on.
First, congratulations on winning Best General Poster Research Presentation at ISPOR this year. What prompted you to focus on RA patients with prior inadequate response to biologic DMARDS? And why is this research critical now?
Yeah, to provide a little bit of background, patients with moderate to severe RA have several treatment options, from conventional DMARDs like methotrexate to more advanced therapies like biologic or targeted synthetic DMARDs. However, despite having these treatment options, many patients fail to achieve remission and often require them to cycle through many treatments before they find the right one. This patient population is really of great interest clinically and for ongoing drug development, with several products being currently tested in early phase trials. So there's a real need to generate real-world evidence in this space to support clinical decision making.
The study leveraged real-world data, or RWD, from OM1's RA dataset. What advantages did the dataset offer for uncovering these predictive trends?
Yeah, so the OM1 Premium RA dataset is a multi-specialty real-world dataset with linked claims and EMR data. And what many people may not realize is that you really cannot do this study with claims alone or EMR data alone. For example, if you only use EMR data, you don't get detailed information on prescription fills. And if you only use claims data, you don't get the deep clinical information that captures a patient's disease activity after treatment. So having these types of linked data sources like ours can really expand the range of study questions that can be answered with real-world data.
Now, how might these insights around comorbidities like obesity, COPD, and fibromyalgia shape clinical decision-making or inform personalized treatment approaches?
Yeah, I think what our study shows is that two contradictory things can be true. On the one hand, patients have many treatment options that they can use to achieve disease control. However, not all patients benefit uniformly from these treatments. And we saw in our study that over two-thirds of patients who start a new medication after a prior inadequate response still fail to achieve disease control. And further, we identified that patients with certain comorbidities like obesity, COPD, fibromyalgia, et cetera, were less likely to achieve a low disease activity or remission. And what this really highlights is the need for a more holistic management of these patients, and also the significant impact of these comorbidities on the clinical management of RA.
How do you see tools like the Clinical Disease Activity Index, or CDAI, and estimated CDAI evolving to better capture disease control in real-world rheumatology practice?
Yeah, leveraging CDAI scores from the EMR data is essential to assessing the real-world effectiveness of these medications. Typically, these types of disease activity scores are used as outcome measures to assess efficacy in randomized trials, but they're less frequently recorded in routine care. So while having the EMR data is crucial to capture CDAI recorded in routine care, many patients may not have one recorded. This is why the eCDAI, developed by OM1, which is a machine learning-based estimation of the CDAI score, is really useful to augment patient outcomes or to identify eligible patients who otherwise might not be picked up with just the observed CDAI.
Now, as a final thought, what does the study say about the current RA treatment landscape, and where do you see opportunities for innovation?
Yeah, I think future research should more formally explore the interaction between these comorbidities and disease activity outcomes. There are also many modern statistical methods to assess treatment effect heterogeneity, whereby we can identify the exact profile of patients that may benefit the most from a given medication. And using such approaches can help us get one step closer to personalizing care for these patients.
Great. Thank you for sharing your insights today with us, Chandra. To our audience, thank you for tuning in. You can find more info on OM1's Rheumatology Data Network on our website, om1.com, or follow us on LinkedIn, Facebook, and X. If you'd like to be notified about our next episode, make sure you're subscribed to our email list to stay updated on the latest insights. Thanks again for joining us, Chandra, and to everyone watching, we'll see you again next time.